Hi, I'm Josh Ratner, and welcome to Health Alliance and You, a health and wellness series brought to you by Health Alliance of the Hudson Valley. Your shoulder is the most flexible joint in your body. It lets you place and rotate your arm in many positions. It is this flexibility that also makes your shoulder susceptible to instability and injury. Here to discuss ways of keeping your shoulders healthy is Dr. Stephen Maurer, a board-certified surgeon and medical director of Health Alliance's Center for Orthopedic Specialties.
So orthopedic surgery is the treatment of musculoskeletal disorders, including bones, ligaments, tendons, muscles. It's a 5-year training program after completing medical school. In addition, many people, such as myself, do fellowships in subspecialty training. So I did 2 fellowships, one in research and one in sports medicine. So the most common complaints that I see are for the shoulder include rotator cuff problems, either inflammation or tears, bursitis, which is a very common condition in men and women in their middle age, arthritis of the shoulder, simple tendonitis. A lot of things go away on their own, but I think it's always good to be evaluated by someone like myself, because I can then determine whether or not it's something that needs aggressive treatment or not. And if it's something, tendonitis, something of that nature, then I can prescribe medicine and a home exercise program or physical therapy, and people can treat themselves. A lot of things won't get better, in which case then you get more aggressive other tests, MRI scans and things of that nature. So rotator cuff arthropathy is arthritis that develops in a shoulder that has a long-standing rotator cuff tear. It's becoming more and more commonly recognized. So what happens when you have someone who has a rotator cuff arthropathy, the shoulder over time, from a lack of a rotator cuff, will progressively become high riding. So the top of the humerus will articulate with the undersurface of this bone called the acromion. So when the rotator cuff is deficient for a long period of time, this occurs, and they'll develop arthritis of the shoulder and even actually start to develop carving out of the bone underneath. A typical shoulder replacement for that won't work because the rotator cuff is required for a typical shoulder replacement. So for that, you do what's called a reverse shoulder replacement, whereby on the socket side, you put a ball, and on the ball side, you put a socket. So you're reversing the concavities of the shoulder. And what it does is it makes a muscle called the deltoid muscle, which is the fleshy muscle on the outside that everybody can see. It makes that muscle the motor to elevate the arm so that you're no longer requiring the rotator cuff. So it does twofold. Number one, it eliminates pain because you're taking away the arthritis. And number two, it gives people the ability to raise their arm up because you're giving them the mechanical advantage by reversing the concavities of the shoulder to raise up their arm. It's probably the biggest advance in shoulder surgery in the last 10 years. I've been doing reverse shoulder replacements now since probably around 2008. And I do probably close to 75 of them a year. It's my favorite operation because you take someone who has, number one, pain in their shoulder and they can't raise their arm up. So they present in the office like this. They can't raise their arm up, and you give them the ability to have no pain in their shoulder and raise their arm over their head. I would say specifically about Health Alliance, I think it's a great place to work. Top-notch nurses, techs, x-ray department, OR staff, top to bottom, is very well-versed in orthopedics. We do a lot of orthopedic surgery there, including joint replacements, spine surgery, hand surgery, arthroscopic and minimally invasive surgery, shoulder replacements. So we do a lot of orthopedic surgery there, and so from the OR to the nursing floor, there's very, very skilled people that are great at taking care of orthopedic patients.
We hope you found this edition helpful. Remember, depending on the nature of the problem, non-surgical methods of treatment are often available before shoulder surgery. Early diagnosis and treatment of shoulder problems is key and can make a significant difference in the long run. For more health information or to view this episode again, visit hahv.org. I'm Josh Ratner. Join us next time for another edition of Health Alliance and You, where healthy starts here.